Now coming to pathophysiology. Your heart is failing and there is going to be increase in end diastolic volume. Your left ventricular end diastolic volume is going to be high. As the end diastolic volume is high, it is compensated by increased diuresis. There is a large volume in the heart and this volume is compensated by increased diuresis. As the diuresis increases, it is compensated by sympathetic stimulation. And this sympathetic stimulation promotes further diuresis, which requires further compensation by further sympathetic activation. So, the cycle happens. There is hypervolemia, diuresis, hypovolemia, sympathetic stimulation, again salt and water retention, hypervolemia. So, a cycle is formed. As a syndrome, as the heart failure progresses, the hemodynamic changes, that is cycle of fluid retention and later hypovolemia. This hypoperfusion can disturb many neuroendocrine, humoral and inflammatory feedback, and this can cause functional deterioration of heart as well as all the other organ system. So, with heart failure, there is myocardial injury and reduced cardiac output. Basically, there is going to be hypotension, which is going to stimulate your carotid baroreceptor as well as decrease your renal perfusion. And as a compensatory mechanism, there is going to be activation of sympathetic nervous system as well as activation of renin-angiotensin-aldosterone system. And the activation of the sympathetic nervous system can cause increase in heart rate and inotropy. Your chronotropy and inotropy increases and there is going to be myocardial toxicity. As more and more sympathetic stimulators are released, it is going to be cardiotoxic. It causes negative remodeling and aggravates the already dysfunctional heart. It worsens the LV function. With the activation of renin-angiotensin axis, there is going to be vasoconstriction, which increases the afterload. This vasoconstriction comes from powerful vasoconstrictor, that is angiotensin 2. And there is going to be increased preload, which results from aldosterone. So, your preload is increased, your afterload is increased, your heart rate is increased, all which are injurious to already failing heart. And symptoms of heart failure happen. So, to counter this pathophysiology is important in the treatment of heart failure. Your sympathetic activation is one of the pathophysiological features. So, your sympathetic system can be inhibited by beta blocker. The renin-angiotensin-aldosterone axis can be inhibited by AC inhibitor, ARB, angiotensin receptor blocker, aldosterone antagonist and antidiuretic hormone antagonist. You give aldosterone antagonist and diuretics to reduce the preload. Now, coming to symptoms and signs of left ventricle, your left side failure. The symptom includes dyspnea on exertion, PND, that is paroxysmal nocturnal dyspnea. The heart rate is going to be high and there is going to be hemoptysis. Signs include your basal crepitation, patient will have pulmonary edema and there is going to be S3 gallop, pleural effusion and patient might have chain Stokes respiration. Coming to symptoms and signs of right ventricular failure, the patient will have abdominal pain, anorexia, nausea and bloating. Signs include your peripheral edema, jugular venous distension, abdominal jugular reflex and hepatomegaly. To compare the clinical features on both sides, you have right as well as left heart failure. In right heart failure, there is going to be congestion of peripheral tissue. In left heart failure, your forward cardiac output is low. There is going to be decreased cardiac output, as well as in the back side, there is going to be pulmonary congestion, which is going to affect your lung. So, your cardiac output is low as well as there is pulmonary congestion. Here in right heart failure, there is peripheral congestion. And this peripheral congestion can lead to dependent edema and ascites, liver congestion or gastrointestinal congestion. And this gastrointestinal congestion leads to anorexia, gastrointestinal distress and weight loss, and liver congestion leads to impaired liver function. There will be congestive hepatomegaly, even it can cause severe abdominal pain. Coming to left heart failure, there is going to be decreased forward flow. So, there is activity intolerance and signs of decreased tissue perfusion. That particular organ like renal perfusion can be altered, or liver perfusion can be altered, or even GI perfusion can be altered. And coming to pulmonary congestion, there is going to be impaired gas exchange and pulmonary edema, which leads to signs of hypoxia. With pulmonary edema, there is going to be orthopnea, you have cough with frothy sputum or